And welcome back to the show. April is National Minority Health Month, and Alliance for Positive Change is actually transforming the lives of New Yorkers living with HIV and AIDS and other chronic illnesses, helping people access medical care, manage and overcome addiction, escape homelessness, get back to work, as well as to being able to find community. Now, joining us to share a little bit more in these details is the Associate Director of Supportive Services at the Alliance for Positive Change, Velia Hernandez. And Velia, good to have you.
Thank you. Thank you for
Thank
having
you.
me.
Oh, glad to have you. And it's certainly an important conversation. When we talk about National Minority Health Month, give me a little bit of insight as to what that actually means to you.
Well, for me and for the agency, what it means that we have realized that minorities are receive poor care in New York City and need a lot of education. So we are committed to actually help them achieve better health outcomes by providing the education and the necessary connections to medical. We do provide HIV testing, Hep C testing. Currently, we're doing the COVID-19 test in addition to vaccination in collaboration with some of our partners. So we really realized that not only the HIV/AIDS epidemic, that was the way that we started, was being impacting our community. We realized that there are other areas that need to be addressed, and we took a lead on it.
Yeah. Communities of color have actually been disproportionately affected. We know in the borough of the Bronx in particular, we know the numbers, not number 62, that's the campaign that's out there presently. A little bit about how you're addressing communities of color in the work that you do.
One of the ways that we're addressing is we have a mobile van that we go out in communities and we provide the necessary education and offer testing, including the COVID testing, like I said before, harm reduction services, and we make sure to link them to one of our services that we have in one of our 6 locations, and to one of our partners on medical care. So we have over 100 or 200 peers that provide the outreach in communities, and that includes not only Manhattan and Brooklyn, we also are very active in the Bronx, and they are the ones to actually tell us where we need to go to be able to provide the information and the necessary care that is needed. It been our commitment for the past 30 years to have a partnership with our peers, because they are the best people to tell us where to go and what is needed in the community, because a lot of them have that live experience that lead us into become more proactive in providing and assessing funding to provide care.
You use that word active. I want to talk about a form of being active. It's called Alliance on the Move, and I'm a little familiar with it, but why don't you share with our viewers a little bit about Alliance on the Move?
Well, like I said before, Alliance of the Move is our mobile van. So in this van, we have trained staff and peers that provide the HIV Hep C testing, the COVID-19 testing, and at the Washington Heights site, we use the van to provide the COVID vaccine. And we go through Chelsea, we go Midtown Manhattan, we go to those areas where we know that been impacted by not only the COVID, but other illnesses, to provide education and offer the support that is needed. So when we think that we're going to stay home, we don't stay home because somebody from the community says, hey, we need to partner with you. And because they know that we have such a range of services and specialized educational services, they always call on us, and we gladly go and serve the community. The advantage that we have is that we are, the staff is mixed as well as the peer. We are bilingual. We have various languages. We have Russian, English, French, Spanish. So that allow us to provide the care and the education in any community. But we've actually tried to go and be an impact in the minority community of colors, because that's the one that is more affected because of the stigma, the fear of seeking education, the fear of being turned around because you don't have insurance. And then some people like to judge, and you cannot be judging anyone without knowing the real story.
Yeah. I know that a lot of us have still trying to get around this pandemic. It's been a major challenge for a lot of organizations. How's it been for you and your community-based organization, given the fact that your job is reaching people and touching people, and the pandemic has kind of put that at a halt?
Well, one of the things that we did immediately when we have to close the office to the COVID, what we did is immediately we started to provide services over the phone. And we concentrated and give people hope through the phone and make sure that they have what the necessary means, such as food. Food insecurity is a big thing that happened during COVID and among our community, not only the people that we serve, but also the people around our sites, our offices. So everything we started immediately on the phone, then slowly taking the necessary precautions. There were people that we needed to go and knock at that door to leave a voucher on the door to say, here, I'm leaving you a voucher for food. So that way you could, meet your needs, enrolling people into city programs for them to get food delivery. So we were very smart and savvy, and the management and the upper management ensure and secure that we were trained in terms of safety precautions and gave us the necessary equipment, the PPE equipment that we needed to go out when we needed to go out. We limited some of the outreach face to face, of course, because of COVID, but some of us started coming back to the office around May last year, and started to bring our people back, those individuals that were able to make it to the office and provided the necessary equipment for safety.
Yeah. I know that you do a lot of relying on your peers, and the peers are actually the ones that actually are on the front lines as well. Share with me how the work of peers has made the difference for you in this time.
Well, in this time, like I said, a lot of them were doing the engagement through the phones because we trained them as to how to provide the information over the phone to the people that were reaching out. Some of them that were more proactive and were verbalizing and expressing, I'm not afraid because I know what I have to do. We allow them to go to selective areas, and especially in the mobile van and maintaining social distancing. So the peers were a great help because we wanted to maintain that social distance. So we needed to have somebody keeping an eye on that distance between people, be able to offer masks. We did mass mailing of mass hand sanitizer, the vouchers, gift cards for food, and the peers were very instrumental in helping us put everything in envelopes and taking it to the post office, dropping it off. And they continue to be, like I said, the instrument for us to do our job before the pandemic and during the pandemic. And I give it to our management team and the directors that we always included the peer and the necessary education for them to maintain their own safety and how to relate to others about, how they need to maintain safety and educate them the importance of hand sanitizing, washing their hands, wearing masks, how to wear the mask properly, and also to reach out to them in the event that they needed something specifically that was more than a mask.
Tell me a little bit about what you got coming up in the future before we close our segment.
Oh my God, we have so much going on. So right now we are providing the COVID-19 at the Casa Washington's Heights location. And we did a first round of vaccination for peers, staff, and some family members. And we hope to be able to include the community. Every project that starts small, but we're going to continue to educate the community, not only our patients, our clients that come here. We want to continue to educate them about the importance of seeking medical attention, the importance of talking to somebody about the barriers that they have, because through them, we learn, and then we could go fight for funding. Then we could communicate what the needs are, and the only way to do it is to be out there. It's to be going out. It's like I'm here in the office, but I have an hour that I go outside and I talk to community members. to get to know what is that they need in you, in your family. And through there, by doing that, I get a lot of people coming up. So we're going to be educating people about the importance of us minority to go take care of ourselves in all the senses, not only on the medical side, but also on the environmental side.
Uh,
Part of us.
well, I do want to say that a lot is going on at the Alliance for Change, and thank you so much for.
Plenty.
I'm sorry for taking the time for being with us here today, and really sharing a little bit about all the work that's going on. Thank you so much, Velia.
You're welcome. Thank you. See you soon.
Oh, we'll see you
Bye-bye.
soon. All right,
Yes.
now if you want, no, stay with us for a second, and we want you to stay with us too. Now, listen, if you want more information, visit the website alliance.nyc. Also, you can follow them on Twitter and Instagram at the Alliance_NYC. Do have a lot more show coming up. Stay with us. Open returns right after this.